Hi, everyone. Today, I'm going to be going over the different aspects of epidemiology and what epidemiologists do and what is a vital part of their jobs. And hopefully, giving you guys a little bit of background on this information, you'll be able to better understand why exactly this job is so important and learn a little bit more than you did before watching this video. So, first question that you probably have is what even is epidemiology? To simply describe it, epidemiology is what is happening to the people. Um, Primarily, what I'm going to be focusing on is illness and disease. So, um, this can be what kind of diseases and illnesses the population and people are dealing with. And with this information, they can prevent and control health related issues. And it's just super important. So, to start off with, I'm going to give a little bit of background. So, there are two types of epidemiology. There is descriptive and analytic. Descriptive is going to summarize and characterize health events and issues. And this form of epidemiology looks at who, when, where, and what is happening. So, for example, I'm going to use COVID throughout this little video here, just to keep it the same. But let's say, or when COVID first came out, epidemiologists were looking at who COVID was affecting, when it started, and where it is happening at, and what exactly COVID was. That is a part of descriptive epidemiology, and they gather all this information and then they use that to form like a hypothesis and learn a little bit more about the disease at hand. So, analytic is determining how and why the disease is happening, and they intervene to prevent the disease. Well, prevent the increase of disease. So, again, with COVID, they would be looking at how is it happening? What exactly is a part of COVID and why is it so contagious? Why is it, maybe only happening to certain people or different things like that. Next, I want to talk about what exactly a population is, because epidemiologists use populations pretty often because it's hard to individualize data because there's so many people in the world. They kind of have to make an overall blanket statement sometimes just to describe exactly the disease and different things like that. So populations are groups of people who share one organizing characteristic. And their populations are used to analyze and interpret and generalize disease and illness in individuals. Of course, when you get down to the individual level factors, there may be different reasons as to why people are getting diseases over another. Maybe someone is unhealthy, or maybe someone just has a weaker immune system, something like that. But if you can imagine that trying to do that for everyone in the United States would just be a lot of work, and it honestly wouldn't really be effective. So that's why epidemiologists use a population instead of individual people most of the time. So next, I'm going to be talking about distribution of disease. And this has to do with the population because epidemiologists will look at the distribution of the disease and look at exactly where it's happening in the population and why it's happening. So like I said here, they look at who, what, when, and where. And in doing this, they can look at which groups have a higher prevalence of a disease. So, for example, if an African-American community in rural Nebraska has a higher prevalence of a disease, let's say, for example, again, COVID, they're going to look at why exactly that's happening. Is there something going on in the environment that's causing them to get this? Is it because of, different things like maybe those people are unhealthy because they live in rural Nebraska, or what exactly is the reasoning for that? Sometimes people may be more prevalent to getting a disease because of determinants of health. And determinants of health are things that make people more susceptible for a disease. So this could be, again, if I'm using the example of living in rural Nebraska, not having access to a local health clinic nearby. You're probably going to get more intense symptoms and longer duration of diseases because you don't have a way to access a health clinic and get the help you need. And this could be due to lack of transportation, again, or health clinics, or maybe your age, things like that. And there are a few outcomes of the determinants. Obviously, we don't like to see these happen, but they do happen. Morbidity is an increase of illness, and mortality would be death due to illness or health conditions. So again, with COVID, we were seeing a lot more an increase of disease, which is morbidity, and we were seeing an increase in death. So epidemiologists are going to use this information to hopefully reduce the amount of morbidity and mortality in the population. They're going to take that data. They're going to look at, why are these people getting illness? Why are these people getting the illness? And why are people dying from this? And they're going to look further into that and hopefully prevent the spread of this. And then there are a few different ways to prevent disease. So there are 3 different levels. There's primary, which would be preventing a disease before it manifests. So that would be working out, and different things like that, to prevent getting obesity or bad things that can happen due to obesity, which can be like hypertension, diabetes, etc. Secondary prevention would be health screening and detection. So an example of this would be a TB test before going to college. And tertiary would be limiting disability and improving quality of life. Last but not least, I just want to talk about surveillance of disease. In order to prevent a disease, surveillance and research obviously have to be done. And this can occur by looking at who is being affected, the places where they're becoming infected, and the time at which they are becoming infected. And epidemiologists are going to do a surveillance of the disease in order to learn more about it. And again, bringing it back to the beginning, to reduce mortality and morbidity that can occur due to disease. So this is really important. And epidemiologists have a very stressful job. They do have to look over, populations of people, and it can be a lot, but their jobs are super important in keeping everyone healthy. And if things like COVID happen, they can help initiate different public health measures in order to reduce the spread of it occurring. But thank you guys so much for watching, and have a good rest of your day.